Hey, this is Lynn. I hope everyone's having a wonderful day. I am here today to talk about iodine, in particular the iodine skin patch test. And just to give you a little background, I have been on the carnivore diet now for 6 months, and about 2 months ago, I really restricted my diet down to the lion diet because my gut was still a mess. My rosacea was still kind of hanging in there, not doing that great. It had improved, but I was still having a lot of issues with my rosacea. And so I restricted my diet down to just beef and lamb, and I would use salt as but basically Redmond sea salt as a seasoning, and that was it. I cut out dairy, I cut out eggs, I wasn't having any seafood. I had not been using iodized salt for quite a while, and so one or more of you commented on, well, what about iodine? What's going to happen with your thyroid when you're eating this way? Because I really wasn't getting a source of iodine. So very legitimate, very valid question. With my mast cell activation syndrome, though, iodine ingesting iodine can be reactive for me. It is high in histamine. It is considered to be incompatible with those who have histamine intolerance or who have mast cell disease. So I had tried the Lugal solution, and I tried putting some drops in some water, decent amount of water, like this amount, like 2 or 3 drops only. And as soon as I drank it, my throat started to swell. So here's the concern, like, okay, I can't supplement with that, obviously. So I was wondering, am I going to have a problem with other forms of oral iodine supplements? Am I even deficient of iodine? I feel okay, but my thyroid, I am on levothyroxine. I do have hair thinning. I have, I don't technically have hypothyroidism, can't talk today, but the doctor put me on thyroid medication years ago because my pituitary gland was working really hard just to keep my thyroid hormones at a low level of normal. So it was more like to support my thyroid. The more I'm learning, the more I'm thinking I need to get off of that medication and go with something else. But that is for another video. But anyway, so I decided I need to figure out what can I do. So the question came up as if I don't handle oral supplementation, would it be okay to apply it to my skin? And this transdermal method of medication delivery is very common. So would that work for iodine? And then should I take the skin patch test and see whether or not the skin patch test will tell me whether or not I'm iodine deficient? Is it reliable? So those are the questions that I had. Basically the two things: is the skin patch test reliable to determine iodine deficiency? And is the skin a viable method of delivering iodine as far as getting it into your system and getting it into your thyroid? So I set out to tackle those two questions. So that's what I'm going to share with you what I found. So that's what I'm going to do today. So the first thing I did was take a look and see what studies I could find. And what I was really looking for was something that would replicate reality as much as I could. Now I did find this study that I decided not to use. Okay. It's called Povidone Iodine Skin Absorption, an ex vivo study. Ex vivo means outside of the body. So not exactly as interested in what's happening outside the body, but a lot of studies are done this way, especially initially. But I did read through this study, and basically povidone iodine is the type of iodine that you don't consume. It's used for antiseptic reasons, but they took a piece of skin and put it into, it was separate from the body. So, the whole point with the skin is it's a barrier, right? And so when you take a piece of skin and then you put iodine there, you've already broken the barrier of the skin. So it's not really a good indication of how iodine absorbs on an unbroken skin. So what they were actually looking at was to see how much iodine actually gets into the system when you're applying iodine to broken skin, such as during a surgery, or, for example, people that have third-degree burns and are in a burn unit. I mean, they can get infected very easily. And so, but when you're applying povidone iodine to them, they don't have that skin barrier. And so, of course, there's going to be a lot that absorbs into the system. So I didn't feel as though this study was really what I was looking for, because I'm not looking at applying iodine to broken skin. I'm looking to apply iodine and want to know, if I apply iodine to intact skin, how much of it is going to be available for my body to use. Okay, so we're putting this study aside. Alrighty, so the next thing I found I am using as a reference. This is called the bioavailability of iodine applied to the skin. And it's by a doctor named Guy E. Abraham. It was posted it was published in a publication called The Original Internist, and which I assume is a medical publication, and this was from June 2008. And I really was drawn to this because this is how he starts this article. He says, I have often, and now let me just clarify, he is doing a review of a couple other studies. This is not an article that is actually publishing a clinical trial result. This is him posing a couple questions and looking to see what research there is to answer those questions. So it's kind of more of a review, which I like because someone's done the work. They've dug in and found the studies and found the relevant information. But this is how he starts this, which is why I really liked this. He says, I have often been asked a couple of questions. Number one, is the application of iodine to the skin an acceptable way to supplement iodine? Well, that's my first question, right? Number two, is there any data confirming the validity of the iodine skin patch test to assess body sufficiency for iodine? Those are my exact two questions. So of course, yes, this is like perfect. This is exactly what I was looking for. Okay, so he just starts out to explain, he says the iodine skin patch test consists of applying iodine solution to a small area of the arm, leg, or abdomen. The faster the yellow color of iodine disappears from the skin, the more iodine deficient the person tested, and vice versa. If the yellow color lingers, the more sufficient in iodine the person tested. So he said over 100 years ago, the application of iodine to the skin was used extensively for iodine supplementation. So apparently this is not new. I'm not the one coming up with this. This has been done for quite a while. And he said in 1932, there's a couple people from Rutgers University College of Pharmacy said iodine is being used extensively as a prophylactic and therapeutic agent by application to the outer integument, which is okay. My computer froze again. So anyways, iodine's been used extensively as a prophylactic and therapeutic agent for the skin, and by applying it to the outer skin, it has maintained its place in medicine for many decades. So it's been used for a long time. It says its use by external application is merely on a empirical basis. Very little proof of efficacy has been obtained by experimental work. So the main question is whether or not iodine passes through the unbroken skin, human and animal skin. That at that point that they wrote this in 1932, they said that question had not been conclusively answered. So they were doing it in medical practice, but they hadn't actually tested it out to see whether or not people were actually getting the iodine in their body, and if so, how much. So This Dr. Abraham, he comments on two different studies. Now one of them is just in animals, so it's 44 rabbits and 6 dogs, no human subjects. So that one, we don't know for sure if it really carries over, but based on the findings, I just wanted to draw the conclusion here is that only approximately 12% penetrates through the skin. The remaining 88% of the total iodine applied evaporates. So that was really interesting. And he said that the bioavailability means how much is it available for you for whatever system or organ in your body needs it. So the bioavailability of the remaining 12% that is in the skin is extremely gradual. So it kind of seems like, okay, the skin kind of holds on to it, that 12% that you apply, and maybe it just draws from it if you're deficient in every other area. So but they basically said, okay, yes, that because the skin hangs on to it for a long time, they did see it as a favorable condition for possible prophylactic and therapeutic action. Okay, so that's what happened with rabbits and dogs. But in 1989, there was a study that was done on human beings. And what they did was they wanted to see, so radioiodide is something that is used to assess the thyroid gland. And so iodine itself will compete with the radioiodine for the thyroid uptaking, and so like if you have if you're taking an iodine supplement and you also have the radioiodide, the thyroid gland is going to select the iodine supplement over the radioiodide. So they were looking to see, okay, so what happens if we take a group of people and they split them up into four groups. So one was a control, and I'll go over what the other 3 were. But they said, like, so what's going to happen if we give these other 3 groups both radioiodide and supplemental iodine? And is the thyroid, let's see what the thyroid does. Let's see how much of this radioiodide is left in their blood, because theoretically, if the iodine gets to the thyroid gland like it's supposed to, and the thyroid gland pulls in and takes what it wants of the iodine, it's going to leave the radioiodide in the bloodstream. I hope that makes sense. Because the thyroid gland is very, very efficient at taking only what it needs. It has some storage, but it regulates itself really well. And so it's not going to take up more than what it needs. And it will take up the actual iodine before it takes up the radioiodide. So you give both at the same time, and the better the thyroid takes up the iodine, the more of the radioiodide is going to be left over in the blood. I hope I explained that clearly. So what they did is they had 24 male volunteers. They were aged 21 to 51 years old, and they were divided into the 4 groups. So the one group was just a control. They didn't have any supplemental iodine at all. They had I don't know, let me see, were they given radioiodide? Let's see. Yeah, they all were given radioiodide. Yeah. And one group didn't get any supplemental iodine. And so the other 3 groups, sorry, I'm kind of fumbling back and forth here. So one group received a tablet form of iodine. It was in the form of potassium iodide. It was 130 milligrams of potassium iodide, which is equivalent to approximately 100 milligrams of iodide. So that's kind of a lot of iodine. The second group got 80 milligrams of iodine tincture on the skin. And then the last group got 100, double the dose, 160 milligrams of iodide tincture on the skin. So we have one control group that didn't get any supplemental iodine. We have one group that got a tablet, and we have two groups who had it applied to the skin, but at different dosages, 80 milligrams and 160 milligrams. So what they found, and then what they did is they tested the radioiodide thyroid uptake at 2 hours, 6 hours, and 24 hours after ingesting the radioactive iodide. Okay, so what they found is that the oral iodine did better, and then the 160 milligram dose of on the skin was the next best, and then followed by the 80 milligrams in the skin, and then the control group was the worst. They did not have any supplemental iodine at all. So what they concluded, and I'm not going to draw this out too far, but what they concluded is that yes, the skin application is effective, but it's not efficient and it's not practical. And it's not a good way to supplement, because when you look at what happened with human beings, with humans, only 6% of the iodine was available. And so that was even worse than the rabbits and the dogs. So the conclusion was that the actual bioavailability was somewhere between 6 and 12%. So the 12% was the rabbits and the dogs, the 6% was people. And so the serum iodide levels were so much better with the oral iodine. Okay, so that answers one question, which is putting it on my skin going to be an efficient way of getting iodine? I'm going to say no, because I would have to put a lot on my skin, and this iodine is not just a net zero effect on your skin. So you have to be really careful. So I'm going to think, nah, I'm not going to go ahead and do it as a supplement on my skin. So the second question was the serum iodine patch test. Is it a reliable method to tell you if you're deficient in iodine? Okay, so this was really interesting. So what this doctor said is that there's many factors that play a role in the disappearance of the yellow color of the iodine on the surface of the skin. So he said, for example, if iodine is reduced to iodide, which it does, it converts from iodine to iodide, which is still used by the body. But he said it converts, it's reduced to iodide by the skin. The yellow color of the iodine will disappear because iodide is white. So that's one thing that happens. It says in order to regenerate iodine on the skin, one needs to apply an oxidant such as hydrogen peroxide, which further complicates the skin. So if you want it to remain stable as iodine, you have to combine it with hydrogen peroxide, but that complicates things even further. Also, the evaporation of iodine from the skin increases with increased ambient temperatures and decreased atmospheric pressure. I thought that was so interesting. So, for example, the yellow color of the iodine will disappear much faster in Denver, Colorado at 5,000 feet above sea level than Los Angeles, California at sea level. So, irrespective of the amount of bioavailable iodine. So he said that the iodide loading test is much more accurate. He said that is available from 3 laboratories, and he named the laboratories. I'm going to put a link to this article below. So I thought that was really interesting. So basically, there's so many factors influencing that the iodine, actually the appearance, because when we're doing the skin test, we're looking at is the yellow being absorbed into the skin within a certain period of time? But the answer is that, well, okay, it evaporates. And we know that at least 88% evaporates based on the studies that were done. Um, and then it turns to iodide, which is white. So hard to say. So I thought, well, okay. And so I'm going, let's just see, can I figure out like what an endocrinologist might say about this? Because I figure, well, they're a specialist in hormones. So I did find an article, and of course I did the skin test myself. Now, after I did it before I read all this, I thought, okay, is my skin test going to be even, did I even do it right? I didn't know. There's nothing that says how much thickness to apply. Like, it didn't say like take this many like drops or whatever. And I thought, okay, now I'm wondering, did I even apply it right? Did I apply too much? Did I apply too little? I don't know. What was the temperature of the room where I was at? I mean, I'm at like 600 and almost 700 feet above sea level. How much difference does that make? So I found this article called Endocrinologist's Take on the Accuracy of the At-Home Iodine Test. Now, this was not written by the endocrinologist, but this was an author who wrote this and referred to or interviewed an endocrinologist. And this was published May 17th of this year, 2023. So, and it did mention painting a 2-inch patch on the forearm, which my patch was bigger than 2 inches. So already I'm kind of off on that. So this author interviewed, and I am going to butcher this endocrinologist's name. I'm just right up front, I'm telling you that. So Dr. Omira Quijano Vega. I hope that's right, because it sounds like it's Latin. I did have 3 years of Spanish in high school, so hopefully that's correct. This is an endocrinologist, said that measuring iodine in the body is hard because it is mainly inside the thyroid gland, and testing through the skin leaves room for errors and inaccuracies, which I agree. So this endocrinologist said that from her, I think it's a she, personal research, and as an endocrinologist, does not feel the skin test should be seen or interpreted as a reliable test. There are simple mistakes that can be made, such as putting too much or too little iodine. Yeah, that's the question I had for myself. I don't know. Did I put enough on there? So, and she also defined hypothyroidism as a severe iodine deficiency. It's the most severe iodine deficiency, which makes me wonder why they throw levothyroxine or another one of the thyroid medications at a person with hypothyroidism. Like, I never had my doctor say, here, take an iodine supplement. But if hypothyroidism is the most severe iodine deficiency present it's about 5% of the population, then why not have everybody supplementing iodine? I don't know. But this doctor, actually, like, they mentioned another doctor named Dr. Simmons. So it must have been more than one endocrinologist that was consulted here. Explained the best way to boost iodine levels is to consume sea vegetables such as seaweed. You can also get it from sea salts, strawberries, fennel, Himalayan salt, broccoli, coconut oil, spinach, cranberries, and watercress. Avoid processed foods. She said your body recognizes nutrients better when they are in real food. So that might explain to me why I can handle dietary sources of iodine better than I can handle a supplement. My body is okay with it, which makes sense because it's an essential mineral that our body needs. So I think that it's very, very, very rare to have a true iodine allergy, and it's probably just an allergy to like contrast, not dietary iodine. I don't think there's such a thing as an actual true iodine allergy from that perspective, because I don't think your body can be allergic to something that it needs to live. I don't think so. That's what I'm reading. So, anyway, so the iodine skin patch test is supposed to be 2 hours. This person says here to leave it for 24 hours. I've seen 12, I've seen 24, and observe whether and how fast it is absorbed. Um, so if the basically the faster it fades, it could suggest iodine deficiency. So this other endocrinologist that they talked about, Dr. Jennifer Simmons, explained, while it's obviously not an exact science, people who are truly iodine deficient absorb the iodine more quickly within a few hours. But again, how much of it is evaporation? I don't know. So she does note that she uses the test in her practice because it's easy, accessible, and affordable. So I think that it's like fine if you want to use the test, and she's going to explain that she uses it just as a screening, just kind of not as a definitive test, but just kind of as a just to get an idea of whether or not you might be needing some more supplementation. So she said she advised people to put it either on their breast, the inside of their forearm, or anywhere that isn't going to have a lot of friction, which makes me think, okay, you can rub it off too. So you got to be careful. So it's important to wait till it dries to avoid being wiped off onto the clothing, and to skip bathing for 24 hours while it's on because it will wash off. So you have to be careful where you apply it. So let's see here. So deficiency, so they test for deficiency by testing the urine. It says 90% of iodine consumed from any source is eliminated in the urine. So 90% of what you consume is your body's getting rid of it. Deficiency is indicated when the concentration is below 100 micrograms per liter. Yeah, so anyways, she said that this is just the test should just be serve as a guide, but it should be followed up by further testing. So do not use it to make a diagnosis. But however, she did note that she's using this Dr. Simmons is also using the skin test for patients as a guide to tailor and personalize nutritional protocols. I think that's cool. She said she's using the skin test, and if the iodine is absorbed in less than 4 hours, she increases supplementation and recommends iodine-rich foods like sea vegetables. So she uses it just basically as a quick screening to see maybe we need to tweak your nutrition and maybe we need to increase your iodine supplement. I think that's fair. So I was like, of course, I get into digging in even more further because I'm like, okay, well, I'm not going to eat sea vegetables. Right now I can't have dairy, I can't have eggs. Do I need to supplement iodine? Maybe. But I have one more study that I dug into, and this is going to be the last thing I'm going to cover in this video. It's called Effect of Excess Iodine Intake on Thyroid on Human Health. And this was published, let's see here, April of 2017. And let me see, it's called a publication called Minerva Medica. There was a lot going on in this article. Okay, so the one endocrinologist in that study talked about kelp, like seaweed, as a good source of iodine. So this article that I am reading about the effect of excess iodine intake is interesting. It said that some individuals are prone to develop hypothyroidism after chronic iodine administration. So there's a possibility that if you take too much iodine, you can actually induce hypothyroidism. It says this type of hypothyroidism is temporary and subsides after iodine exposure ceases. The development of goiter or even hypothyroidism in people without known thyroid dysfunction is rare. So you're less likely to have this happen if you don't have any issues with your thyroid. If you do, you may be putting yourself at risk if you take too much. So it's really important to figure out how much is the right amount to take. You don't just start popping thyroid supplements and think you're going to be fine because it can actually make you hypothyroid. Um, there was a study done about in Japan. So iodide-induced goiter occurrence in um, about in a northern island of Japan. And I cannot pronounce this. But they said the inhabitants of this region were consuming large quantities of seaweed, especially kelp, containing large quantities of iodide. It's been estimated that the quantity of iodide ingested daily may exceed 200 milligrams. And they experienced a lot of issues with goiter. So the goiter has disappeared after the restriction of intake of kelp products in the affected areas of Japan. So that was interesting because this endocrinologist was recommending the seaweed. But this shows, and not that I'd say, the seaweed can't be a good source of iodine. I'm just saying be cautious because you can get too much. And like these people on this island off the coast of Japan, they were getting too much and they were developing goiter. And so we know that 200 milligrams a day, which was the equivalent they were taking, that was not good for them. So I thought that was really interesting. What they say is endemic iodide goiter has been observed in 64% of children in an area located in central China, consuming water containing approximately 500 milligrams per liter of iodide. And yes, there is iodine in water. That is an interesting fact. So in a study from China, euthyroid goiter, which means that there's nothing wrong with the thyroid, but goiter was observed in 10% of subjects of 19 Chinese counties caused by iodine-rich drinking water. Interesting. So they're trying to help us by putting iodine in the drinking water, but they ended up with goiter. So it says here, despite the evidence provided by the previous studies, it is still controversial whether completely normal subjects may develop perturbed thyroid function after exposure to large doses of iodine. We did not observe abnormal thyroid function tests in 20 normal adults treated with 80 milligrams of Lugal solution for 2 months. 2 months is kind of a short period of time, but it is something. So they were saying if you don't have anything wrong with your thyroid and you take 80 milligrams of Lugal solution for 2 months, you should be fine. Now, I don't know why you're supplementing if your thyroid is functional, and how did they assess that? I don't know. But they said that we believe iodine-induced hypothyroidism does occasionally occur in normal individuals, but is exceedingly rare. Yeah. So it's really interesting that they've done these. They're kind of epidemiological studies, so you can't necessarily say there's a causal relationship. They're basically just looking at a population and seeing a trend. Like there's a correlation here, possible correlation. They don't know for sure whether or not it causes it. So here's another part. It says excess iodine and thyroid cancer. That'd be concerning. So it says the incidence of thyroid cancer has risen worldwide. The wide use of diagnostic imaging and surveillance likely contributes but cannot fully explain this increase. In the USA, thyroid cancer is the 5th most common cancer in women, with an approximately 3-fold rise reported over the last 4 decades. So it should be noted that the data are controversial. Some of the highest incident rates of thyroid cancer are found in Iceland and Hawaii, both known to have long-standing high iodine intake. In Tasmania, an area where a well-documented history of iodine deficiency, subsequent supplementation was linked to a 4-fold increase in papillary thyroid carcinoma. So basically in Tasmania, the iodine that was naturally available in the soil, in the food that they got, was low. So there's iodine deficient geographic areas, and there's iodine sufficient geographic areas. So what they're saying is that in this area that they considered to be iodine deficient. They started supplementing people, the population. After they started supplementing, thyroid cancer went up 4 times as high. So that was interesting. So in China, a recent study on the effect of iodine intake on thyroid diseases in China, 3 respective communities. So here's 3 communities in China. One had deficient iodine intake, what's I guess technically considered deficient. One had normal iodine intake, and one had excessive iodine intake. I didn't say what the cutoff was here. They were surveyed for thyroid diseases in a period of 5 years. So in the 2 areas where they had deficient iodine intake and normal iodine intake, there were no cases of thyroid cancer in those 2 areas at the beginning of the study. So nobody had thyroid cancer in those 2 groups. But at the beginning of the study, 10 in the 3rd group, where they were already getting too much iodine, excessive iodine, when the study started, there were already 10 patients with thyroid cancer in that area. And then during the course of the study, in the 3rd area, where they're getting excess iodine, 13 new cases of thyroid cancer were diagnosed, but none were found in the 2 other regions. So normal iodine excess is fine. In this case, when it comes to thyroid cancer, even deficiency is better. Excess puts you at higher risk of thyroid cancer. So it says the same year, another study compared thyroid cancer incidence in Eastern and Western Denmark in the period of 1973 to 1997. And no regional difference was found in the overall incidence of follicular or papillary thyroid. And they compared those 2 areas because one was considered to be an area of mild iodine deficiency and the other was more of a moderate iodine deficiency. They didn't find any difference in cancer. So it seems like deficiency is better when it comes to cancer than excess. So they believe, according to this article, they believe that the evidence is weak, that there's an associated with increased thyroid cancer. So I don't know, maybe more study needs to be done. It says after iodine prophylaxis, that means taking it for prevention, it has been demonstrated to have a clear relationship between increased iodine nutrition and elevation of thyroid cancer and follicular thyroid cancer. There are 2 types of cancer. So there's basically an increase in the papillary thyroid cancer. This has occurred even in modest increases in iodine urinary excretion. So I know that was kind of a lot, but I wanted to share this because I just want to make sure that even though I'm doing this video on iodine, that I don't want people to go out and just start supplementing iodine, because I think it's something we have to do with caution and with care. Determine, are we deficient? I'm going to go over that more in another video and ask the question, what does deficiency actually look like? How is deficiency measured? What's the best way to figure out if you're deficient? Like, what are the symptoms of deficiency of iodine? The thyroid, this is the conclusion. I'll just read you the conclusion here that they said. They said thyroid homeostasis. Basically, that means the ability of the thyroid to maintain the levels it needs exerts an enormous plasticity over diverse intake of iodine. So basically the thyroid is extremely flexible, that plasticity. It can adapt. You can throw some iodine at it. You could have not enough iodine. It's very adaptable. And it does have stores of iodine that it can draw from. It says the extreme situations in which normal thyroid function are under pressure are iodine deficiency and iodine excess. But I think it probably means severe in both of those cases. The deleterious effect of iodine excess were delineated in this review. Either hyper and hypothyroidism can be developed under this condition. So that's interesting. You can have too much iodine and you can actually, and you can supplement iodine, and you can develop either hypothyroidism. Those are the articles that I read. So based on this, so I will show my, my skin patch results, which seem to indicate that maybe I'm not deficient. I mean, how much of it evaporated, I don't know. But I am just going down this iodine and thyroid rabbit hole because I want to have the answers to these questions. I did decide I'm taking a multivitamin, which has the U.S. daily recommended amount, which is 150 micrograms. So I guess the question is that a lot of people take more than that. So is that sufficient? I don't know. We're going to find out. So anyways, I hope this hasn't been too boring and too data filled, and I'm, stumbling over trying to go through these articles because they're packed full of information. But I hope it's been helpful. And I've been kind of putting off doing this because there's so much to go over, and I just didn't want to present it in a way that didn't make sense. So I hope it made sense. Please comment below. Let me know, is there anything that didn't make sense here? Is there anything that I need to clarify? Is there anything that seemed contradictory? Is there anything that seemed off? I mean, I'm a nurse, but I'm not an expert. I'm not an endocrinologist. I never worked in endocrinology. So I don't know. Is this something that I'm doing right? Am I doing wrong? I don't know. Give me your feedback. I hope you're all having a great day. Bye-bye.